2020 was a strange year. In late 2019, a new or novel coronavirus emerged and quickly spread across the globe. This virus touched every nation on every continent. Stay-at-home orders were issued, businesses closed down, schools shut their doors. The world, it seemed, had stopped turning, ushering in a new normal that none of us were prepared for. On March 10, 2020, Governor Ned Lamont declared a civil preparedness and public health emergency, activating the Connecticut National Guard. Its mission was to assist state and local authorities combat the virus, leading to the largest domestic deployment of troops in recent memory. March and April were a sprint to get a head start on stopping the spread of the virus. Our mission started with soldiers, airmen, and militia members helping build surge capacity for the hospitals across the state. The state militia constructed mobile field hospitals in Sharon, Hartford, Middlesex, and Danbury. We inspected and delivered ventilators, which were in high demand. We operated a warehouse to facilitate the organization and distribution of personal protective equipment such as masks and face shields. We teamed up with Yale University to conduct an antibody test in order to better understand the behaviors of COVID-19. We hosted video conferences with Uruguay, our state partnership program counterparts, to engage in constructive conversations about lessons learned and best practices. We began supporting the first drive-through testing sites and stood up a mobile testing laboratory for hard-to-reach populations. In May, we also partnered with local emergency response organizations to launch a pilot program aimed at scaling testing operations. We began constructing testing kits and paid tribute to all the frontline healthcare workers with a flyover of hospitals and healthcare facilities around the state. In June, while taking the utmost caution and following CDC guidelines, our units successfully started their annual training season. It was no small feat, but a necessary one. While still performing COVID-19 response duties, the Connecticut National Guard also needed to prepare more than 1,000 guardsmen to mobilize for upcoming overseas deployments. From July through October, we continued distributing PPE and testing kits, never stopping despite having to bring on additional troops to assist with cleaning efforts from storms that ravaged the southern end of the state. It was also in this timeframe that we hit the 1,000th nursing home inspection milestone. In November, while families were still feeling the pressure imposed by the pandemic, our guardsmen helped spread a little holiday cheer by distributing Thanksgiving meals to families in need. This was a hallmark event of the Guard's ongoing mission to deliver food, in partnership with nonprofits and the Department of Agriculture, to those families struggling to put meals on the table. As we prepared to ring in the new year, a glimmer of hope shimmered on the horizon in the form of a vaccine. In January, our soldiers and airmen who had been a constant fixture on the front lines of the pandemic response received their first doses. This would lead to a follow-on mission to help administer the vaccine to the people of Connecticut, a huge milestone in the journey toward returning to our pre-pandemic lives. Throughout the first year of our COVID-19 relief mission, we helped deliver more than 152 million pieces of PPE and nearly 900,000 testing kits. We established 46 testing sites and 40 vaccination sites, and we conducted more than 2,500 nursing home inspections. Without a doubt, the COVID-19 pandemic changed our lives and will have consequences that stretch far into the future. But if it's shown us anything, it's that the National Guard holds true to its motto, always ready, always there.